Welcome to this educational YouTube video on the fascinating topic of anatomy of the cranial nerves based on the renowned Gray's Anatomy. In this video, we will explore the intricate details of each cranial nerve, their functions, and clinical significance. Let's begin with an introduction to the cranial nerves. The cranial nerves are 12 pairs of nerves originating from the brain and are responsible for controlling various sensory and motor functions in the head and neck region. Each cranial nerve plays a crucial role in our daily lives, ensuring our ability to see, smell, hear, taste, and move our facial muscles. And we will revise each of nerve. Olfactory nerve, also known as cranial nerve 1, is responsible for our sense of smell or olfaction. It originates from the olfactory bulbs in the brain and passes through the tiny holes in the ethmoid bone called the cribriform plate. The olfactory nerve allows us to perceive a wide range of scents in our environment. However, damage to the olfactory nerve can result in anosmia, a condition where individuals lose their sense of smell. Optic nerve or cranial nerve 2 is vital for vision. It originates from the retina of the eye and exits the skull through the optic foramen. The optic nerve transmits visual information from the eye to the brain, allowing us to perceive the world around us. Any damage to the optic nerve can lead to the visual impairment or even blindness, affecting an individual's quality of life. Oculomotor nerve. This nerve originates from the oculomotor nucleus in the midbrain and exits the skull through the superior orbital fissure. The oculomotor nerve controls most of the eye movements that allows us to look up, down, and from side to side. It also regulates the size of the pupil, that is known as the pupillary reflex. Dysfunction of the oculomotor nerve can lead to eye movement disorders and abnormal pupil responses. Trochlear nerve plays a crucial role in eye movement control, and its origin is from the trochlear nucleus in the midbrain, and it exits the skull through the superior orbital fissure. The trochlear nerve specifically controls the superior oblique muscle, which is responsible for downward and inward eye movements. Any damage to this nerve can lead to weakness in these specific eye movements. Let's now explore nerve 5 or the trigeminal nerve, one of the largest cranial nerves. It has 3 branches, the ophthalmic, maxillary, and mandibular branches. The trigeminal nerve is responsible for providing sensory information from the face and controlling the muscles involved in chewing. Damage to this nerve can lead to facial pain, sensory disturbances, and difficulty in chewing. Abducens nerve is responsible for eye movements. It originates from the abducens nucleus in the pons and it exits the skull through the superior orbital fissure. The abducens nerve controls the lateral rectus muscle, allowing outward eye movements known as abduction, and its dysfunction can cause difficulty in moving the eye laterally. Facial nerve is associated with our facial expressions, and it originates from the facial nucleus in the pons and exits the skull through the stylomastoid foramen. The facial nerve controls the muscles of the facial expression, allowing us to smile, frown, and show various emotions. Additionally, it plays a role in taste sensation from the anterior 2/3 of the tongue and stimulates tear production. Damage to the facial nerve can result in facial weakness or paralysis, as seen in the condition called Bell's palsy. Vestibulocochlear nerve or cranial nerve 8 is responsible for our sense of hearing and balance. It originates from the cochlear and vestibular nuclei in the brainstem and exits the skull through the internal acoustic meatus. The cochlear division of the vestibulocochlear nerve is crucial for hearing, while the vestibular division is involved in maintaining our balance and equilibrium. Damage to this nerve can lead to hearing loss or balance problems. Cranial nerve 9, the glossopharyngeal nerve, has diverse functions related to the throat and tongue. It originates from the glossopharyngeal nucleus in the medulla oblongata and exits the skull through the jugular foramen. The glossopharyngeal nerve controls swelling, provides sensory information from the throat and tonsils, and carries taste sensation from the posterior one-third of the tongue, unlike the facial nerve that has the anterior one-third of the taste sensation. And dysfunction of this nerve can result in difficulty, swelling, or loss of taste sensation. The vagus nerve or cranial nerve 10 is the longest and most complex cranial nerve. Actually, the origin is from the dorsal motor nucleus and the nucleus ambiguous in the medulla oblongata and exits the skull through the jugular foramen. The vagus nerve plays a critical role in regulating various bodily functions such as heart rate, digestion, and respiratory rate. Additionally, it is involved in vocal cord movements. Dysfunction of the vagus nerve can lead to gastrointestinal or cardiac issues. Cranial nerve 11 or the accessory nerve primarily controls specific neck muscles. It originates from the upper cervical spinal cord and joins the cranial nerves, exiting the skull through the jugular foramen. The accessory nerve is responsible for movements of sternocleidomastoid and trapezius muscles, allowing us to turn our heads and shrug our shoulders. Damage to this nerve can result in weakness or paralysis of the affected muscles. Cranial nerve 12 or the hypoglossal nerve. We conclude our journey with this nerve, and it originates from the hypoglossal nucleus in the medulla oblongata and exits the skull.